Pain from CMC arthritis. The CMC arthritis is right here at the base of your thumb. The pain there can make you feel really weak. It can make you feel like you can't even hold a cup or even open something. So a lot of times people assume that because they can't do certain things because of their CMC arthritis pain, that you need to do a lot of exercises to get it stronger. My name is Huang. I'm an occupational therapist and certified hand therapist, and I'm going to show you the one exercise you really need. Yes, there's a bunch of exercises you can do. Yes, you can get really creative and do a bunch of things, but I don't know about you, but I don't have time to do like a gazillion different exercises if I don't want to. I want to get to the point and do the one thing that I need to do and then be done with it, right? So there's other things you can do. It's not necessary exercise. For example, like getting manual treatment, getting someone to like massage or position your bone or your thumbs or move your joints in a very particular way can feel really nice and get rid of your pain. But if you're going to try to do it by yourself because you have some CMC arthritis and you're just like, I can't hold things, I feel like I can't open things, like I don't have strength, it's the only exercise. Right? Grab some rubber bands. These are nothing fancy. I always have a mix of rubber bands. And if you can see, these are two different like lengths. And you can get rubber bands that are different thicknesses. So it just depends on where you're at in terms of how painful you are. But the exercise I'm going to share with you is literally just this. You get a rubber band, you put it in between your thumbs and around your fingers, and all you need to do is to open it up, right? Now your fingers are working too. This is a great exercise overall. But for your thumb, you would put it and you would open it up. Go like this. I tell my patients that all the time. So what's happening here is you're working to make your thumb open up. Now you can get fancy and you can lower it down and you can just, I have really freakishly mobile thumbs. Like look how much my thumbs move, right? So, but if you wanted to, you can hold it down right here with your other hand and just work on your thumb. Just bring your thumb up and down. That's actually kind of hard. And then you have to use your other thumb. So I just say, put it around your fingers and just open it up like this. And here's the reason why I think this is the only exercise you need. Yes, there's a bunch of exercises you can do. Yes, I do a bunch of different exercises with my patients, but if you're going to pick one, this is the one. And here is the reason why. I like to explain always why I do what I do, because I think that if you understand why, maybe you'll do them. So a lot of times what happens with a CMC arthritis is that this joint right here, the bone here, just kind of, let me move my camera, falls into your palm because the muscles in your thumb, look at this thumb muscle, look how strong it is, right? These muscles are really strong and your thumb tends to fall into your palm. And so what happens if you sit there and you do a lot more gripping and a lot more squeezing, it's just going to continue to fall into your palm. But what we need is our thumbs to be able to actually open up and like stretch out wide so you can grab that cup, right? So you can hold on to something. And then also when you go and you pinch and you twisting something open, when your thumb can actually stretch and open all the way out, your muscles get really long. And then when you need to go in and pinch and do something small, it can get really short. Muscles only get long and get short. They get long. They don't go wide. They don't do that. They just get long and they get short. So if you can do an exercise where you're helping your muscles right here get longer, believe it or not, you'll be able to bend it a little bit easier. This is my number one exercise that I do with all of my thumb patients. Now, sometimes if you have thumb pain, this might not be the best exercise to start with, but it's definitely an exercise that I encourage you to do. Like, so if you think this rubber band is too strong, then you get a bigger rubber band to make it a little bit easier. And if this is too hard even, then you might have to do it yourself. Like you might need to push it up and then hold it there, hold it. this kind of exercise is called a place and hold. It means I place it there and then I hold it. So if you can't do it yourself, you would take your other hand and place it up, and then you tell yourself, hold it, hold it, hold it, hold it, and then relax, right? So it depends on where you are in terms of how severe your CMC arthritis is. It depends on how much pain you have. But if you don't have that much pain and you're feeling kind of weak and you feel like your thumb is like stuck inside your palm, you want to pull it out, you want to stretch it open. This is a really great exercise for you to do. Try it out. Let me know below. And obviously, if it hurts, you might not be ready for this. Go try to find an occupational therapist or a certified hand therapist who can help you kind of get started with first, get rid of your pain, get your thumb to move a little bit better, and then you can do some exercises without any pain. All right, my name is Huang. I'm the occupational therapist and certified hand therapist here at Hands On Therapy Services. We're located in Miami, Florida. And if you're in Miami, you need some help because your thumbs hurt you, give us a call. The link's below. And if you have any questions about CMC arthritis, for sure leave them below, because it's your questions that I'm able to create more videos that can help you just understand more about it and like what you can do. All right. Let me know in the comments below. And until next time, thanks again for watching, and I'll see you soon.